The conversation regarding the introduction of the comprehensive sexual reproductive health education in basic schools has been met with criticism from a section of Ghanaians, while some say it is an attempt to introduce same-sex relationship. Others say it will expose children to indulge in early sexual activities. However, according to a recent research commissioned by NORSAC, an NGO, and conducted in the 5 regions of the North, 54% of students revealed they did not receive any sexual reproductive health education information (SRHE) from parents. Thus, they say, is worrying as children out of ignorance could engage in unsafe sexual activities. Bugri Abudu is a headmaster of one of the junior high schools in the Northeast region. He tells Citi News how the lack of information on SRHE has led to some teenage pregnancies in his school.
We are on the ground. If you want to get the reality of it, unless you come to the primary school, the junior high, then you will know what we are talking about. As I speak to you, before this, my GSS, I registered 65 students to write. I will tell you, 3 were pregnant with 2 carrying babies. Even GSS 1, some are already giving birth and they are there. What are we doing? What has brought that? Can we stop it?
Speaking at the sidelines of the 2nd National Reproductive Health Forum in Tamale, organized by NORSAC with support from Axis and UNESCO, the Northern Regional Girl Child Education Officer, Linda Amwa, said there is the need to relook at the methodology in educating the public about sexuality education in schools.
The education, the methodology we've taken has a problem. The content itself has no problem. But the methodology in which we bring the content out to the public is where the problem is. We need to educate the public. We need to sit down with stakeholders, then fish out what is it that Ghanaians don't want about this. What they don't want, we can take it off. What we think will be good for us and our culture, because in everything we need to be proud of our culture. And if something will come in and actually look down or be at negative with our culture, I don't think people will accept it.
Meanwhile, the study conducted on whether or not sexuality education should be taught in basic schools and presented at the forum revealed that 86% of students and 75% of teachers were comfortable with the introduction of SRHE in schools. However, parents and other stakeholders believe that sexuality education should begin with children between age 12 and 15. Here is the lead person for the research speaking more on the findings and recommendations.
Teachers and then students both agreed that they will prefer SRH in the junior and basic schools because it seeks to clarify values and then it is able to do away with myths and misconceptions about sex. And then they also said that they will need a curriculum so that SRH will be taught effectively in schools, because currently the way SRH is taught is not really effective.
For the executive director for NORSAC, Mohammed Awal, amid the fears of introducing SRHE in schools, making available the right information for the youth is the best way to go.
You hear some people tell you that, oh, this thing has been with us for so many years in our communities, people do that, they are hiding to do and all that. Maybe they used to be hiding. This time around, we are bringing it out for the public to know what others are doing. Or they just feel like we have reached a point that we should be demanding our rights. We have laws in the country. The laws may uphold some of these things. But then let's also find out, how do we give people the right information? If we want the sexual intercourse in a particular way, why not get our young people to understand that in our context, this is the way we do it? Then running away from it and say, don't discuss it.
From Tamale, I am Dinah Ngwan for Citi News.